I'm Ms Monika Kaushik. I work as a consultant oncoplastic breast surgeon. I also do cosmetic breast surgery and reconstructive breast surgery. I work in the Leicestershire and Nottingham area. So I chose to do breast surgery because as I was training, I realized that this is a specialty where I could actually connect with the patients. Being a woman myself, I think there could be an emotional connection, and that's why I chose this specialty, especially knowing what women can go through when they have this diagnosis. It's not just about the illness and the disease, it's the entire journey that they go through emotionally, and also regarding the body image issues. So I just felt that I could do more in this specialty, and hence I chose this specialty. I think the most rewarding part about my job is that I get an opportunity to be a part of my patient's life when they're going through this difficult moment in their life, where I found that patients can actually connect and talk to me when they find it difficult to, they don't know how to go about and talk to their own partners, family, and in a way it's I feel privileged that I can guide them through this process. So this is something, I think the emotional attachment and to be a part of the journey of the patients is the most rewarding thing about this specialty. I think the most things the patients value about myself is, they would be able to answer this question better, but I think the important thing, what most patients have told me about it whilst they have been under my care, is that they value the honesty that I tell them about their illness upfront. There are no hidden messages or anything. I tell them as it is. And I'm empathic towards their progress in the journey of their illness. I give all the options to them. Each person is an individual in their own right, and circumstances around them are different. So it's not about my view and my opinion, but I help them in that journey, which actually helps them make decisions about their treatment options. So this is something I think my patients value about me. And like I said before, the most thing I value about them is that I get to be a part of this journey with them. And I still have my patients all through these years that I've treated who are still in touch with me. They can contact me anytime, and I'm there for them wherever I am at whatever point in time of the day. It has a few challenges. It's not always a smooth journey for my patients. And I think one of the most frustrating things and challenges of this specialization is when I'm not able to cure my patients. When they have a recurrence of the disease, it's the most devastating thing for them and for me equally. We want to help and just get the patients back to their normal life journey. But there are ups and downs in the pathway of these patients. And that is something is very frustrating, and obviously the challenges, I would say, in this field. Like I said in my earlier answer, I stopped there abruptly, but it is a thoughtful process, and I always go back to my basics, what we can do when these frustrations arise. I think one of the most important thing is the thought process when there is a recurrence in the illness in the patients, or when there are no good outcomes and the patients are unhappy. I think the important thing is to sit down with the patients, be honest about what can be done. I don't hesitate to take a second opinion when I am frustrated. I don't know what to do. How much ever experience you have, lots of my colleagues will have their own experiences, and I never hesitate to take a second opinion. I have very good relationships with my colleagues and senior colleagues who have had, who are in this field as well. So I would do that. I explain to the patients about what can happen in the future journey. I go back to my colleagues. We discuss this in a multidisciplinary team approach, and then come back to the patients to discuss how we would go forward, obviously keeping them in the center of the discussion.